So my name's Jay Santana and I'm a district nurse with Newport. So I go to visit patients in their own homes, people who are unable to get out for various reasons, be that end of life needs or they are just incapable of leaving the house themselves due to disabilities. So then we visit them and deliver medication, or a lot of our role is to do with leg ulcers, so we go and bandage them and give therapy for them. Normal day for a district nurse would be having their list. We go to our first time patients, which would be a diabetic, where we would administer their insulin, checking their blood glucose, making sure that they're all well and feeling okay. Also in the mornings we would do eye drop visits, where we would be administering their eye drops, checking for any infections then as well. If this patient's in the morning are also not that mobile, we'll be checking for pressure sores or any pressure areas that have developed or not developed, which is what we're looking for. Leaving there then, if we're lucky, we've got quite close patients, which we travel about 4 to 5 minutes to, but it can take up to 20 minutes. We do deal a lot with GP surgeries because we have patients that are attached to surgeries. So we liaise back with the GPs via telephone, or if we can get into them. A lot of our connections with GPs will be for drug charts that we need to be written up, so in order for us to give medication, and palliative end-of-life patients. We work quite closely then with the GPs. So going into the community gives patients that opportunity then to have care within their own homes and not having to go into a hospital environment. A lot of patients are better cared for than at home because of their personal preferences being, given to them. That gives them a better mental health as well by being at home, which then in turn, physically, they do tend to recover a lot quicker. The challenge is going into other people's houses. You don't always have people on hand to ask advice from. You haven't got a doctor on hand to say your concerns to. You are quite autonomous in your decisions, and the decisions you make do weigh heavily on your shoulders, and it is a massive responsibility. You don't have the sterile fields to give medication or to do bandaging or sterile dressings. You kind of have to make that yourself. And some people's houses you go into aren't always the best to make that situation for yourself. So you're just literally trying to do the best you can with what you've got on that day. We work massively as a team in the community. We're always ringing each other, making sure everybody's okay. We've got quite a large team in Bettis. There's 2 teams combined. So there are a lot of experienced nurses you can call on, and people who have their niches of specialities in their own rights that they will know the answer to. And then also helping with patients. If one patient becomes unwell, they will help you either come or take off patients, and they'll go and do them just so everyone's getting the same level of care throughout that day. I wanted to be a community nurse because there's that time with the patient. You've got nobody on your back waiting for you to see to them, that you are solely with that one patient and you can spend as much time as you want with them. Going from student into a qualified nurse on the district, it can be quite daunting as you are on your own and you're making those decisions by yourself. You haven't got that doctor who's on the ward that you can just run things by, or that experienced nurse that's been working there for 20 years by your side. You are on your own, and that can be a very daunting task at times. District nursing will be changing massively in the near future as part of the clinical future strategy of care closer to home. Patients do recover quicker in their own homes. We're having IVs now at home, antibiotics and everything, so patients are not having to go into hospital. So it will be a lot more that we will be doing in the community in the near future. It's a fantastic job to be in because once again you have those relationships with patients, and you can truly see the help that you're giving them following it through.